Hello and welcome. Today we're speaking about safe access to medical marijuana. With me is Jonathan Bair of Americans for Safe Access. Jonathan, thank you for coming.
Thank you for having me, Tom.
So tell me about your organization.
Americans for Safe Access is America's leading advocacy organization for patients, doctors, and medical researchers to have access to marijuana for therapeutic purposes. We are celebrating our 10th anniversary this year, and it's been a long journey since 2002, but today in 2012, medical marijuana has become a salient issue in the national discussion, and there has been a lot of efforts to create safe access throughout the country to patients who are suffering.
So your organization has been at the ground level at a lot of the legislation that has enabled some of the states to eventually legalize marijuana, and now we have 17 states where medical marijuana is legal?
Yes, 17 states and the District of Columbia have laws on the books that allow patients to access marijuana for their medical needs. Different states, of course, have different approaches. Some have registration statewide or statewide regulations. Other states like California don't have statewide regulations, but still have a fair amount of access for needy patients, and especially in California, for medical researchers.
So what's your current focus? You have a lot of programs going on. You're a national organization. You have multiple offices. What's your focus right now?
Well, right now, we are just a month before the presidential election, and today our focus is on introducing the topic of medical marijuana to the national discussion. Recently, polls have shown that 80% of Americans, including 2/3 of Republicans, support patients having access to marijuana for therapeutic use. We're hoping to see that public support translated into electoral support. We also, right now, are approaching oral arguments in our lawsuit, Americans for Safe Access versus the Drug Enforcement Administration, at the Court of Appeals in Washington, D.C. ASA v. DEA is a case that argues that marijuana is improperly scheduled under the Controlled Substances Act, that Schedule I's definition of no accepted medical use in the United States is simply untenable after decades of very exciting research into the therapeutic uses of marijuana.
So a Schedule I drug is a drug that has the maximum penalties and has no acceptable uses.
Right. No accepted medical use means that there is no, under federal law, no reason for anyone to have access to marijuana for any reason. There are very stiff penalties that accompany the law, but there are also, but even worse than perhaps these individual penalties that are on the books, there is a culture of law enforcement that prevents really any regulation on the federal level and prevents much research into the therapeutic uses of this drug. The Economist recently said that if marijuana were discovered today, it would be hailed as a wonder drug. But instead, we are looking at almost a century of marijuana prohibition that has created a stigma around marijuana and has prevented scientific research into the benefits of this drug.
I had assumed that a lot of the pushback was the large drug companies and their lobbyists because of all the money that would be lost. It seems that when you read about the benefits of the studies that have been done for marijuana's ability to replace pain relievers and a whole host of drugs, not only replace them, but with very minimal side effects. I assumed that was the pushback, but as we spoke earlier, you told me that it was actually the law enforcement community.
Yes, law enforcement is the primary opponent to granting safe access on local, state, and the national level. From the jobs in the Drug Enforcement Administration to the property seizures allowed under the United States drug laws, the bureaucracy of law enforcement benefits tremendously from making this widely used drug illegal.
So let's talk about the benefits of the drug. Your website mentions that it's been used for 5,000 years, documented, but as long as we've had writing, so
yes,
could have been much before that.
Certainly. Cannabis has been found in Egyptian tombs.
Yes. That's interesting.
Yes, there is a millennia-long history of documented use of cannabis, both for medicine and its relative hemp for its other uses, such as rope, early forms of plastic, other industrial uses of hemp. But of course, the therapeutic benefits of cannabis have been known to man for a very long time.
Some of those it's an anti-inflammatory agent. It's a wonderful pain reliever.
Certainly. One of the most popular uses for cannabis in the United States right now is to combat the side effect of toxic prescription drugs that are given to people who are in a life-threatening situation, such as cancer patients. And marijuana, which lacks harmful side effects, can ameliorate the side effects of other drugs and can supplement those drugs, for example, by preventing nausea, stimulating appetite, and pain relief without the sort of haze that opiates can cause.
Well, those are three of the main problems that people have that have cancer, and when they're having the treatments, you experience that you can't eat and you can't sleep. And I remember reading a description of someone wrote a letter to the newspaper and said that his girlfriend had cancer and was in treatment and chemotherapy, and she couldn't eat, couldn't sleep. She would take a couple puffs of marijuana, and she would get hungry and eat a little bit, and she'd take a couple more puffs, and she'd get sleepy, and she'd go to sleep. It was the best relief that she had. It seems that your website has case after case just like that, not only chemotherapy patients, but many, many uses.
Yes, there are many documented uses of marijuana for medical purposes. There is, of course, an enormous amount of anecdotal evidence of the benefits of this drug, but there is also increasingly peer-reviewed scientific evidence of the benefits of marijuana. In fact, recent studies suggest that marijuana can not only complement chemotherapy treatments, but can directly battle cancer. And these are very promising areas of research that cannot be fully undertaken without the federal government granting permission for scientific researchers to have access to cannabis. The National Institute for Drug Abuse has a monopoly on the provision of marijuana for scientific purposes, and the agency chooses to fund and provide access to studies that show the harms of marijuana, and there is very limited access to studies that show the benefits of marijuana. So while California has provided state-level access in a pioneering program that recently ended with wonderful results, there are still many barriers to scientific understanding of the various properties of this drug. Those are barriers that Americans for Safe Access is working to overcome. And those barriers, in and of themselves, are used as an argument against marijuana access. Some say that because it's not documented through FDA-style blind testing, that there cannot be medical use the way we understand it in Western medicine. Yet, those trials are not often allowed under federal law.
So how big is your organization? What's your budget? How are you funded? And
Americans for Safe Access is a membership-based organization. We have about 40,000 members across the country. We have at least 2 members in every congressional district in the United States. We are organized into chapters throughout the country, and we have offices in Oakland, our headquarters, in Washington, D.C., in Los Angeles, and affinity groups and key allies throughout the nation. We've been working especially hard recently in California, in Michigan, in Montana, in DC locally as Washington begins to implement their medical cannabis law, and throughout the country. This year, in 2012, there are 2 medical marijuana initiatives on the ballot in Massachusetts and in Arkansas. And there's also a referendum in Montana that seeks to overturn the state legislature's gutting of a previously approved medical marijuana initiative. The battle continues in many states. There's obviously a federal role for medical marijuana advocacy, but there's also a state and local role for medical marijuana advocacy. It's the states that, under our current regime, set the law for doctors' access, for the cooperatives or other ways that patients can get access to this drug without having to grow it themselves. There are local regulations. You may have heard about the city of Los Angeles, where there have been many failed attempts to regulate the cooperatives and organizations that seek to provide access to marijuana for patients. And that's an example of the local regulations that are needed, even in a state with a very wide-ranging medical cannabis access law, in order for patients to actually get the medicine that they need.
There was a mention on your website of a very scary precedent where some of the doctors that were prescribing marijuana were getting letters saying that they could be prosecuted for that, and that was a case that was taken to the Supreme Court?
Yes, that case did result in a less, the Supreme Court case regarding doctors recommending medical cannabis did result in a lessened atmosphere of intimidation for doctors. And today, in 2012, we see prominent doctors such as Dr. Abrams, the director of oncology and hematology at the University of California at San Francisco, publicly performing studies on the efficacy of cannabis, creating programs in continuing medical education for doctors, and through the efforts of Americans for Safe Access and others, doctors face less intimidation. There's also clearer rules. Doctors issue recommendations, not prescriptions, for cannabis. That's a change since the 90s when this issue first arose on the state level. There also is the need for a clear distinction between the doctor's recommendation to their patient and the provision of the drug itself.
Seems that it's such a schizophrenic situation. You have the states trying to maintain their rights and wanting one thing, and the feds coming in and trying to impose their will. And
exactly. In the Gonzalez v. Raich case in the early 2000s, the Supreme Court ruled that the federal government does have the right to stop patients from even growing and consuming their own medical cannabis under the Interstate Commerce Clause, despite the lack of any actual commerce and certainly any interstate nature of that commerce. So under the Controlled Substances Act, as we see it today, with cannabis in Schedule I, there's a very clear federal prohibition on medical cannabis. Yet patients do need this medicine. Many doctors understand the efficacy of this medicine. There are many advocates and others who are willing to form organizations or cooperatives to provide medicine to needy patients who cannot necessarily grow it themselves. And so there's a continuing disconnect between what's happening for patients and communities and the federal law itself.
Is there a country we can look to as a model for how to handle this?
Israel has broad access to medical cannabis. There's a lot of research into medical cannabis in Israel. I'm not extremely familiar with the provision of medical cannabis but I do understand that it is not through the pharmaceutical system but through patient cooperatives like it is in California and in other states, but with officially sanctioned research and provision. The United Kingdom has very liberal approaches to medical uses of all drugs, including cannabis, whether they're in Schedule 1 or another schedule. Most countries use our similar system to the Controlled Substances Act. Usually, actually, the numbers are reversed, though. So Schedule 4 in many countries is the most restrictive schedule, and Schedule 1 is the least restrictive. And of course, in the United States, it's the opposite. But under an international treaty, governments are required to implement a law similar to the Controlled Substances Act that has been used as an argument against the provision of medical cannabis in the United States. Some say that because of this treaty, there is no way that the United States could ever provide medical cannabis access. But Israel and other countries who do provide medical cannabis access are signatories to this treaty.
Well, Jonathan, I read recently that they're researching marijuana that doesn't get you high, to sort of take that quote unquote side effect away. What do you think of that, or are you have you been keeping up with that?
Well, certainly at ASA, we are very excited to see research into different ways of using the drug to help patients. There is a dispensary in Oakland called Harborside Health Center. It's the largest medical cannabis dispensary in the world, and their scale has allowed them to experiment with strains, with methods of ingesting the drug that produce different results. A famous use of this is what they call high CBD, low THC strains, and those are the two identified chemicals in marijuana. Marijuana, of course, is an organic plant. It's an organic chemical. It's very complex. And with the lack of research, we haven't identified it as well as we have identified, say, the human genome. But in general, there is thought that there are the CBDs, the cannabinoids, which are separate from the THC, tetrahydrocannabis. And THC is thought to create the psychedelic effect of marijuana, whereas CBD is thought to cause the other effects of marijuana that are often more sought after in therapy, such as reducing blood pressure and other physiological effects. Some patients have found that high CBD, low THC strains enable them to seek relief for the symptoms that they're suffering from. Those symptoms can include seizures and other very serious afflictions that make it very difficult to live a normal life. But without the THC element, it's easier for these patients to ingest as much marijuana as they need to control their physical symptoms while still maintaining a clear mind and being able to work and enjoy the life that many of us take for granted.
Are there some patients where the euphoria that the THC generates is not just a side effect, but a very welcome medicinal effect?
Certainly. THC has medicinal use in and of itself. The pain-killing element of marijuana, which kills pain with less of a psychedelic effect than an opiate-based drug, is sought after by many patients. At Americans for Safe Access, we are a patient advocacy organization. We support patients having access to what they need to reduce their suffering. So we get very excited by different ways of producing, of using cannabis, but in the end, we're happy to see anyone find relief from their suffering. I mean, there certainly is a recreational use to marijuana that people enjoy and have fun with, and then there's also a medical need for it that is very serious, and what Americans for Safe Access does is serious, and we work for people who often believe that this medicine is saving their lives. But at the same time, while this is a very serious issue, there is a recreational drug that we're talking about to some extent, and it's something that can make people happy and can make people enjoy their life more, which is a great benefit of medicine.
You have case studies on your website of 82-year-old people who are in very serious pain and have found very serious relief through cannabis. And really they're saying, I have the right to this drug, and it shouldn't be kept from me.
Yes, under common law, there is a medical necessity defense. However, a series of Supreme Court rulings have very much narrowed the medical necessity defense as it comes to possession and use of marijuana for medical purposes. Medical necessity defense does not apply to doctors, does not apply to cooperatives that provide this medicine. Then the federal government says publicly that they don't go after patients for using it, but instead go after distributors and growers and other people who are more in the supply chain of marijuana. But of course, many of those people are patients themselves who got into cultivation because they needed it and couldn't find any other means of access. And frankly, it's not reasonable to ask someone to grow their own plant for their medical needs. People who have medical needs are often disabled because of those medical issues that they're facing, and so simply don't have the capacity to cultivate a plant that takes many months and is complex. You can make your own aspirin, you can grow it and make it yourself, but no one asks anyone to do that. So why should we ask people to grow their own marijuana? That, of course, is a choice that people can make, but we definitely at Americans for Safe Access, when we say safe access, we mean access that is convenient and safe in the sense of both safe from law enforcement, but also safe in terms of good medicine. So Harborside, again, this large dispensary, because of their scale, they've been able to implement testing of marijuana to ensure that there are no molds or pesticide residues. That's something that we take for granted with many drugs, including herbal products that are not regulated under the FDA system or the Controlled Substances Act. We take that for granted with our food. But for those who need marijuana, because there is a lack of a large market, there's a lack of regulation, those safety measures are not taken for granted. It is Harborside with its scale that's shown that there is a way to provide that level of safety to patients. And so when the federal government says that Harborside is too big and therefore must be violating the spirit of California's medical marijuana laws, that is very disturbing to those patients who depend on the unique medicines that Harborside offers and depend on the testing that Harborside's able to do with its scale. There are other dispensaries here in the Bay Area where we have a network of cooperatives who can then take advantage again of the scale and use these testing facilities to ensure that the medicine is safe for their patients.
Well, Jonathan, if a viewer is watching and they're sympathetic, how can they help you?
There are many ways to get involved in the struggle for patient access to medical marijuana. Americans for Safe Access is a membership-based organization. We love to have more members, and even signing up for our email list is a great way to plug into the movement and to see what's going on in your own community, whether it's here in the Bay Area or somewhere else in the nation. If you go to americansforsafeaccess.org, you'll find a way to sign up for our emails. You'll find a way to join Americans for Safe Access, and you'll find information about local chapters and about the different laws in the different states that do allow medical cannabis.
What about writing to the editor of your newspaper? It seems like the media is on the wrong side of this issue.
I certainly would say the media is not nearly as supportive of this issue as I'd like them to be. But I do appreciate that there is an increasing amount of coverage of this issue as it is more and more in the national consciousness. We've actually seen in this presidential election the issue of medical and recreational marijuana coming up in questions, especially to the Republican candidates, who often in this particular cases in these recent elections have said things that are sympathetic, only to be immediately retracted by their campaigns. So we'd like to see the spotlight shining on this issue. We'd like to see candidates addressing the issue.
All right, Jonathan. Well, thank you for coming here and talking to us about your organization, and I wish you all the best.
Thank you, Tom. It was a pleasure.
All right. And thank you for watching. Good night.